Go.
Hi, my name is Stacy Gardner. I want to take a moment and thank you for giving me the opportunity to present my SWOT presentation on Broughton Hospital. SWOT is an acronym for Strength, Weakness, Opportunity, and Threats. Doing a SWOT analysis is an excellent way to identify what the internal strengths and weaknesses are of an organization and also what the external opportunities and threats are. This is a picture of Broughton Hospital. It's located in Morganton, North Carolina. It's the only state-run psychiatric facility for the western part of the state. And it has been operational since 1883 and serves the mental health needs of patients in western North Carolina. The first patient at Broughton Hospital was in 1883, and his name was Dr. Pepper. And yes, that really was his name. He was really a physician, and this information is publicly available. So who does Broughton serve? We serve patients, adults ages 18 to 65, geriatric, adolescents ages 9 through 18, the deaf population, and also mentally ill patients with comorbid medical conditions. Broughton's mission statement is here. It's to partner with individuals by creating opportunities to recover from mental illness and substance abuse disorders by instilling hope, facilitating choice, promoting healing, and supporting their personal journeys of wellness. Their value statement is to be an exemplary environment of inpatient healing, hope, and compassion by partnering with individuals who have mental health and substance abuse needs. Broughton's positive attributes or strengths are longevity, recovery model concept of care, it's a state-operated facility, it's a teaching hospital, and it's a regional educational facility, and there's also the reputation to consider. Broughton has been in operation since 1883. It originally started with just the one main building, but has expanded over the years. Recovery of care is a treatment concept. The service environment is designed so that patients have primary control over decisions about their own care. As time passed, care of the mentally ill has improved significantly. We have gone from treating patients as if they were feral dogs to respecting them and giving them the dignity they have an absolute right to. The recovery of care concept is in contrast to the traditional models of patient care. Past care of the mentally ill included a regimented program in which patients were told what to do, how to do it, when to do it, but never why to do it. Now they are part of the decision-making process regarding their own care. This is also reflective of Broughton's mission statement. Broughton is a state-operated facility. The perks for that is that they have state funding, and they also have a status of working for the state is great. They have other state resources available to them, and they've used the successful conceptualizations of the Dorothea Dix Hospital as its model. Also, staff retention lies with career state employees. Broughton Hospital is a teaching hospital. It's taught nurses, physicians, psychiatrists, psychologists, social workers, nurse practitioners, physician assistants, and others. Being a teaching hospital, it gives Broughton the opportunity to fully educate future health care of America. Those professionals will learn about the stigmas of mental health care and what exactly is required of what care is required for the mentally ill. This lends to a more global understanding of the needs of the mentally ill and can potentially eradicate some of the stigma associated with mental health disease. This is also included in the value statement. Broughton Hospital is a regional education center. It allows them to be an exemplar in the care of mental health. The reputation of being able to provide proper care for patients who are not successfully treated via other means. Patients who are not being able to be treated at other facilities such as Catawba, Fry hospitals. Those patients typically come to Broughton, and there's a higher success rate of treating these patients. They also have a reputation of being a great place to earn a paycheck. The paycheck for staff, the benefits package makes up 33% of the whole wage package, so that's also a great benefit and strength there. Broughton's weaknesses: reputation, it's state or operated, nursing shortages, perception of lack of support from managers by nursing staff, frequent staff injury, poor morale, and institutionalization of staff and patients. Broughton has a reputation of having too many queen bees and not enough worker bees. This has created a negative impact with the nurses. They feel that they are unsupported while taking care of the patients. Although it's a positive was it was being state operated, that can also be a negative. Funding is dependent on the state's budget. Funding is not always available to make up for staffing shortages or other unforeseen issues that might come about. And it's highly regulated by state and federal entities, possibly even more so because of the patient population that is served. Nursing shortages. Adequate staffing is an absolute necessity in order to provide safe and compassionate care to patients. There's just no getting over that. We need proper staffing numbers in order to promote patient safety, staff safety, and to provide the optimal care that we want to provide. Lack of administrative support. Like I said, there's a perception of lack of support from managers by nursing staff, and that can produce a hostile work environment. It kind of creates an us versus them mentality, which only continues the negative work environment. Staff injury, that's a big weakness. Inherent in any psychiatric facility is a potential for violence in staff and or patient injury. When psychiatric patients become upset, they generally strike out. Patients can also become extremely paranoid, and all you want to do is give them their medications and they think that you're trying to poison them. So as a result, there's a lot of staff injuries at Broughton. All the items that I just discussed lead to poor morale. Poor morale leads to poor nursing judgment at times, and it also leads to poor care of the patients. Institutionalization. Both patients and staff are at risk for becoming institutionalized. Institutionalization is a term that has been deemed to be a very negative term, and it goes along with the stigma of mental health facilities. The opportunities at Broughton are, they have a new facility coming. There's more than a century of treating mentally ill patients, which creates the opportunity to realize the vision and mission statements, and there's an increased number of people afflicted with addiction disorders. I'll explain that in just a second. Longevity. Broughton has extensive experience in working with the mentally ill, given that they've been open for more than a century and they have all this experience. That would lead one to believe that they are expert in their area of care. There's a new hospital that's slotted to be open in 2018. It's the general thought that staff moving to the new hospital will bring with them some degree of excitement moving into the new building and away from the old, what a lot of staff refer to as a decrepit building. Addiction is included as a mental disorder in the Diagnostic and Statistical Manual of Mental Disorders. Addiction is an opportunity for the Broughton to make more money by focusing more on addiction diseases. It is in their mission statement, however, the focus isn't quite there enough. If they would put more of a focus on patients with addiction, whether it's drug, alcohol, gambling, sex, any of those other types of addiction, they have the potential to earn more money and be reimbursed more by Medicare and Medicaid. The threats at Broughton include lack of computerized documentation, the ever-changing governmental rules and regulations regarding the care of the mentally ill, and a toxic work environment. Computerized documentation does not exist at Broughton Hospital. Everything is still done the old way, paper and pencil, and this leads to miscommunication between Broughton and outside facilities, outside physicians, psychiatrists, and psychologists. So that could eventually harm their reputation in the care of patients. Governmental influence. The ever-changing policy and procedure plays a large role in how care is delivered in any setting. Patient psychiatric care plans are greatly affected by changes in government dictated by policy and procedure, and again, probably might even be considered to be more strict because of the nature of this patient population. There's still that stigma attached to psychiatric patients. Toxic work environment. This is a huge issue. Low morale, an us versus them mentality, emotional toll of caring for the mentally ill, constant risk for injury to staff from violently psychotic and paranoid patients, and constant mandatory overtime due to staffing shortages. When performing a SWOT analysis, it is important to recognize that strengths can be viewed as weaknesses and opportunities and vice versa. Does anybody have any questions? I'll be more than happy to answer any questions you may have. Thank you for your time.